This year at ACC, the results of the POISE-3 trial were presented, and this trial answered two very important questions that we face in clinical practice in patients who are at high risk of bleeding and high risk of cardiovascular events and who undergo non-cardiac surgery. The first question is if using tranexamic acid, we can reduce the risk of bleeding without increasing the risk of thromboembolic events. And the second question is if in those patients who are hypertensive and are on medication prior to the surgery, we can maintain that medication or we should stop it in order to avoid hypotension during the surgery. The trial recruited more than 9,000 patients, and for the first question, the patients were randomized to tranexamic acid prior and after surgery versus placebo. And the patients who received tranexamic acid had less bleeding events without any difference in terms of measured adverse cardiovascular events as compared to placebo. For the second question, there were patients who were maintained with the same medication against hypertension throughout the non-cardiac surgery and patients in whom the medication was stopped. Again, there were no differences between the groups for what concerns the risk of major adverse cardiovascular events. Therefore, the POISE-3 trial presented very important results that are going to impact in our clinical practice.